The humanitarian system has been talking about putting people at the center of humanitarian action for decades now. And in recent years, it seemed humanitarians were getting quite tired of discussing accountability to affected people in so many fora with limited progress. And that accountability had become something technical that's done by the AAP or community engagement people. But there is some growing momentum around accountability again, with increasing recognition that crisis-affected people are the reason the humanitarian system exists, and that the system's ongoing struggles to put them at the center are raising important questions for its future. This momentum represents an opportunity to make some practical gains. In this briefing, I'll share the latest research findings and learnings with you on AAP, which we at ALNAP feel point to the crux of the challenge around improving accountability. The set of issues are not easy to address, but they are tangible enough to see some hope for real operational progress on this long-running sticking point for humanitarian actors. I expect many people are quite familiar with the headline statistics on accountability, so it might be useful to be reminded first of what aid recipients are saying about the system in their own voices. I don't think that we can influence decisions about aid because we're only beneficiaries, and the international organizations are the ones that decide this matter, said one aid recipient in Yemen. When we complain to them about something, it takes up to 6 months to receive the response. People get tired of waiting, so they just don't give any complaint and feedback, reported another from the Rohingya camps in Bangladesh. So these quotes reflect discussions with aid recipients across 5 countries for the recent State of the Humanitarian System report. This lack of progress is leading to disillusionment and distrust. We heard of crisis-affected people disengaging with humanitarian actors and services, while others found alternative routes to be heard by the system they felt was ignoring them. For example, complaints to local government, open letters, and even protests against agencies. This has implications for communities, but also on the ability for agencies to operate effectively and to do their job. So in this briefing, I'll situate us on current progress on the system's commitments to accountability, raise some of the key issues that have led to humanitarians getting stuck in this current situation, and finally, explore what hope there may be for the system being released from that inertia to make meaningful progress for crisis-affected people. This all builds on the research we conducted for the latest State of the Humanitarian System report, or the SOS, our ongoing engagement in the IASC Task Force 2 on accountability to affected populations, plus a more recent literature review on current accountability practices and key informant interviews with different parts of the sector. So first, examining the system's performance. It's worth taking a quick step back to remind ourselves of how long the accountability issue has been around. As you can see from this timeline, it's far from new. The system has been having concerted conversations about being more accountable to crisis-affected people since the late 90s, well before the latest commitments made during successive grand bargain processes. Yet, what progress have we seen? The answer to that question is unfortunately a relatively limited amount. There's been evidence of some activities and outputs, with an increase in response-wide accountability frameworks and country-level working groups on accountability. But we've seen little real change for communities. The recent SOS report found that only 36% of people in our aid recipient survey thought humanitarians communicated well with them, down from 39% in the last 2018 report. While only 33% said they were able to give feedback or complain, again, a decline from 36%. This is echoed by a recent global analysis by Ground Truth Solutions, which found that most crisis-affected people want to have a say on aid provision, but only a minority felt they had any influence. While recent multi-agency evaluations on COVID and Ukraine indicate continued failings in communicating to people and responding to their needs. This limited progress is frustrating, given that feedback and consultation lead to better humanitarian assistance in the eyes of aid recipients. They see varied gains. We often hear that accountability should be invested in for moral reasons because it's the right thing to do. And indeed, our SOS survey found that those who were consulted on the aid they received and those who could provide feedback were respectively 2.4 and 2.9 times more likely to say that they were treated with dignity than those who were not engaged. But we also found that people who were consulted prior to receiving aid were more likely to say it was relevant, sufficient, and of good quality. So far from being an add-on or a nice to have, effective accountability processes have the potential to tangibly improve the effectiveness of aid. So given decades of initiatives and the centrality of accountability to effective humanitarian performance, why is the system still struggling? We see several pinch points that are keeping the system stuck, but these are feasibly addressed with the right leadership level consideration. These relate to the skills and structures of the system, pressures from the changing global context, and the type of power balance needed for truly accountable relationships. So we've known for a while now that there are issues in the structure and incentives for accountability, but recent research has zoned in on two specific aspects of this, focusing on the skills required to effectively engage with communities and the adaptive, flexible processes and systems required to be responsive to their changing needs. The system was designed to deliver a set of basic needs goods to crisis-affected communities as soon as possible, with international actors' experience of previous crises as the starting point, management or technical skills as the main staff requirements, and speed as the watchword. The result is that many international humanitarian actors don't recruit or develop the kind of staff capacities and skills needed to adequately understand the communities and contexts in which they're working. Better understanding communities requires time and strategic investments to hire staff or to seek local actors with softer skills, people who can engage in effective social analysis, yet who still understand the workings and constraints of a humanitarian response. Doing this means seeing communities rather than calls for proposals as the starting point for determining how the system supports them. Leadership initiative is also required to support shifts in organizational systems and culture, to listen to frontline staff and local partners in decision-making. These people more contextually embedded, but with typically limited influence. Interestingly, there's been far less success in addressing the soft skills gap for AAP compared to more recent reform initiatives, like the Humanitarian Development Peace Nexus. We have, however, seen some recent guidelines by IRC on embedding accountability into hiring processes and on recognizing the important role of frontline staff, and from UNICEF on engaging with social science approaches as a useful skill set to improve understanding. But these are still relatively nascent initiatives. Shifting from guidelines to resourcing practical changes in processes is more challenging and needs concerted leadership level support. Which brings me to the second issue of getting the right structures in place to meaningfully close feedback loops and respond to the priorities of communities. The siloing of accountability and community engagement from broader organizational systems and processes is a real challenge to responding effectively to what communities need. Systems must be in place across an organization to support adaptive programming as contexts and community priorities shift. But again, this is not the way the system has been constructed. While frontline staff may want to adapt delivery to respond to what they hear from communities, long chains of decision-making exist, from them to local partners, to INGO intermediaries, and to donors, which limits that project-level agility. And often the culture in organizations is to deliver to an agreed plan to meet set outputs, rather than thinking about how activities and outputs might have to change from those originally planned to enable the ultimate outcome of a project, which should be meeting community needs. Aside from programming and management structures, being adaptive also requires more flexible funding, which despite grand bargain commitments is still relatively limited. There are pockets of progress, notably from the Netherlands, CEDA, and Ireland, and donors may encourage flexibility with trusted long-term partners. So we see this between the German FFO and the German Red Cross, or with the Dutch MFA with the Dutch Relief Alliance. But on the whole, donors are better at incentivizing considerations of community engagement in proposals and reporting requirements than they are with providing the flexibility that would allow for change throughout a project. This is partly hindered by the restrictions of domestic politics, taxpayers, and administration. but also due to the limited evidence from agencies on how they're using flexible funding to actually be more responsive to communities, rather than just plug the gaps left by more restricted funding. We see that sometimes flexible funding becomes divided up between different organizations, projects, and functions that doesn't enable enough flexibility for adaptive programming. And when flexibility is provided to INGOs, this isn't usually passed on to local partners, which inhibits adaptive delivery. So the potential for responsive programming to meet people's changing needs could be better maximized. Those two pinch points were about the structure of the system that has become embedded over time, but which have real tangible opportunities now for seeing progress. The next two relate to pressures on that system from the changing global context that are increasingly raising important challenges to accountability. So the first is the increasingly protracted nature of crisis that's causing problems to the relevance of humanitarian aid to people's needs. In these settings, crisis-affected people are increasingly asking humanitarians to support their longer-term needs, their resilience, and risk reduction from future threats. If agencies continue to focus on a narrow humanitarian remit, they won't be accountable to the needs being expressed by crisis-affected people. So to bridge those gaps, there may be opportunities to better link with development actors via the nexus and with national governments to support these longer-term requests. But this can be tricky in refugee contexts where the politically hairy questions of durable solutions arises. We've seen some success on participatory decision-making in partnership between UNHCR, the Ugandan government, and an elected refugee empowerment forum. But it's harder to be accountable to refugees in environments where the government is more hostile, for example, for the Rohingya in Bangladesh. This raises important questions for organizational leadership about the type of assistance agencies provide, but also on their role in human rights, advocacy, and national politics. As well as the changing nature of crisis, we're also seeing shifts in the funding landscape with implications for accountable humanitarian assistance. Increasing scarcity of resources in the face of rising need in certain contexts is forcing tough choices over allocations. These prioritization decisions affect accountability in two main ways. So first, funds for community engagement have typically been limited and seen as a nice to have rather than core to the humanitarian endeavor. Will scarcity further reduce the focus on accountability processes in favor of more tangible goods? The second key question is whether the voices of crisis-affected communities will have any influence over the where, what, and who of prioritization decisions. We know that crisis-affected people can make different choices than international actors. While the Joint and Intersectional Analysis Framework, or the JIAF, tries to think about people's holistic needs across sectors, the assessments that it incorporates still largely use the logic of the system that focuses on equity, so targeting those most in need using what it considers to be objective measures of vulnerability. But crisis-affected people can have quite different ideas on who should be targeted in their community. Some would prefer to share assistance equally and see this as more legitimate than equity and impartiality. The WFP have been recently grappling with this in Afghanistan. They used a community-based targeting approach to make prioritization decisions, with strong efforts to balance existing local power dynamics with marginalized groups, and importantly, allowing some flexibility in the use of their standard targeting criteria. They also initially withheld some funds to respond to appeals from communities after the initial distribution. So this is still a work in progress, but WFP are continuing to develop these more community-sensitive approaches in different contexts. And the broader humanitarian system will need to increasingly contend with such issues of prioritization. As they do so, leaders should consider whether participation of communities in those decisions could support improved relevance and targeting of those increasingly scarce assistance. So we've seen some potential ways forward with these tricky internal structures and the changing external environment. And there are other examples that we don't have time to cover now. But we can't talk about accountability without considering the issue of power. So this is the hard aspect of accountability and where we're yet to see much traction. So in meaningful, accountable relationships, we see the ability to hold the person or entity in authority to account and to sanction them if they don't fulfill their duties. A persistent issue for the humanitarian accountability is the lack of sanctioning power when agencies underperform or do harm. There are two main aspects to this challenge. So first, it's difficult to expect crisis-affected people to stand up to agencies. There's a big power differential. Agencies have the ability to give assistance or to withhold it. And crisis-affected people may be reluctant to raise their voices if they're used to feeling the brunt of authorities in repressive contexts, and levels of empowerment may differ by age, gender, physical ability, and culture. Second, no efforts to create a system sanctioning mechanism have really taken off. So the humanitarian ombuds idea keeps coming up, but it hasn't really gained traction since its conception as far back as 1997. While Mark Lowcock's suggestion for an independent commission of voices in crisis seems never to have really got off the ground. Together, this means that whether agencies want to listen and take action on complaints is really still just up to them. The role of incentivizing accountable behavior by agencies lies largely with organizational leadership and what they choose to prioritize and incentivize among their staff. So aside from sanctioning, the issue of accountability has strong links with other debates on shifting the power of the system. Calls for locally led action and decolonizing aid are getting louder, and the system is increasingly recognizing that communities are the first responders to crisis, but also the last when international funding reduces. This blurs the lines between being accountable to communities and improving engagement with local actors. While crucially important, I won't address this point in any depth, as my colleague Vijay has produced a separate briefing on issues of localization and locally led action. But I will just mention the applicability of the survivor and community-led response approach that she speaks about in more depth, as a potentially useful way to help bridge this gap between communities as both recipients and active agents in crisis. So among each of those challenges, there are pockets of promise and ways forward, and I'm sure there are other organizational experiences that could be added. Yet most examples nibble around the edges of one pinch point at a time. Few really link these aspects together, recognizing required shifts in programming, processes, strategy, resourcing, and mindset. To make meaningful progress, different elements of the system need to tackle the structural issues in a more coordinated and wholesale way. Despite decades of talk, we haven't really seen the incentives and cohesive force to make that happen. That is disheartening, but recent discussions and momentum indicate some hope. You're by now familiar with the different system-level initiatives working on accountability, including the IASC Task Force 2 and the Grand Bargain Participation Revolution. As reflected at the beginning, we had seen more practical movement on activities and outputs here, rather than evidence of tangible outcomes for communities. But there has been some incremental progress and currently a sense of renewed commitment to find out what it takes to make that leap from process to outcomes for communities. Similarly, the CHS has sought to strengthen accountability in the sector, but the last humanitarian accountability report indicated that commitments on community engagement and feedback were among the most challenging for agencies to achieve. The ongoing revision represents an opportunity to understand and address some of those practical challenges, with the focus of being increasingly people-centered. However, one of the challenges for creating this more wholesale change is that much existing work on accountability focuses on bringing community voices into a pre-existing system designed by internationals, rather than building that system around the people it's meant to serve. So what is bringing some hope for change is the new ERC flagship initiative, which aims for country coordination to redesign structures based on local requirements. So while, as the name says, this initiative originates at the top of the system, it does offer at least the potential of more structural change centered on community voices. We have as yet limited details on consultation processes and questions on how these pilots fit with existing fora. But there is hope that this initiative may provide an opportunity for communities to shape a more participatory response structure. So given the challenges that have been discussed in this briefing, we know this won't be easy. The results will likely depend on how well communities are brought into the conversations to meaningfully influence the design of new structures. But the willingness to create something new and different is promising, as is the focus we're seeing at the highest level on engaging actively with the difficult issue of accountability and power in the system. The imperative now is to capitalize on it. So finally, to tackle some of those challenges across the system, there are things we need to know more about, so evidence and learning gaps to fill. Some relate to community engagement in humanitarian processes. For example, we still don't know how communities perceive accountability in different contexts, what they want an accountable system to look like, and how it should function. We also need more evidence of how to involve communities in prioritization and targeting processes, including on the benefits and the risks involved for socially embedded actors who have to stay and live with the consequences of their tough decisions. Other questions relate to the way humanitarian actors operate. So more evidence is needed to understand how donors and agencies can make flexible funding work and maximize its potential for adaptive and responsive programming. And finally, we need more good practice examples of how the humanitarian system can connect with governments and development actors in different political environments to ensure the longer-term needs of crisis-affected communities are better served. So still a lot to do, but some hope and a few concrete areas identified where a stronger focus could help get accountability unstuck. To support these efforts, I'll leave you with some questions about practical changes that are relevant to operational agencies and donors alike. So how can you enable your organization and partners to work in more adaptive and flexible ways to respond to the feedback and changing needs of communities? What are practical solutions you can find for humanitarians to better connect with development actors and national institutions to leverage solutions for the longer horizon requirements of the communities that you serve? And how can your organizations and partners support effective and ethical community participation in targeting decisions, given tight timeframes and complex social environments? So thank you for your time listening to this briefing. We look forward to continuing this conversation.